to today's HealthLine webinar from the American Association of Kidney Patients, titled A Closer Look at Gout and the Kidney Disease Connection. Thank you for joining us today. My name is Jerome Bailey, and I am AAKP's Director of Patient Engagement and Advocacy. Today's HealthLine webinar event is a special collaboration with our longtime allied partners at the Alliance for Gout Awareness, as we recognize National Gout Awareness Day. AAKP serves kidney patients across the disease spectrum and with various causes of kidney disease, but in partnership with the Alliance for Gout Awareness, AAKP aims to increase awareness of the gout and kidney connection, debunk myths of gout, and ensure individuals impacted by this condition know their treatment options. As the oldest and largest fully independent patient-led kidney patient organization in the U.S., AAKP is proud to host our webinar series as a service to our fellow kidney patients, family members, and care partners, healthcare professionals, researchers, and policymakers. AAKP HealthLine and HealthLine Innovator webinars fall under our Center for Patient Research and Education. We believe patient and care partner education is an integral part of an individual's treatment, and to that end, AAKP is a champion for research and innovation, the protection of the patient-doctor relationship, and the elimination of artificial barriers and government determinants of health that impede patient care choice and access to all available treatment options. At AAKP, we work to ensure that patients have a central role in research and innovation process so that unmet needs are identified and unique patient insights and lived experiences fully inform the research and product development cycle. This includes clinical trials to regulatory action and payment decisions. We are proud to bring you this educational webinar on gout. It is a painful condition that affects more than 9 million Americans. It is important to note that gout can lead to kidney disease, and having kidney disease can increase the risk of developing gout. During today's presentation with our allied partners at the Alliance for Gout Awareness, we will discuss the causes and symptoms of gout, offer advice on effectively managing the condition, and highlight our joint efforts to reduce the stigma associated with gout. But before we get to our speakers, leading up to today's presentation, AAKP conducted an independent flash survey through our Center for Patient Research and Education. I am delighted to share some of the results with you that will help set the stage for our presenters. As you can see, the survey reached across our network to engage a highly diverse group of respondents. This slide indicates that the majority of survey respondents know a little or have a basic understanding of gout. An impressive 61% of the respondents said that a healthcare professional has talked to them about gout. Our next slide asks if you have ever experienced gout, and it looks like a lot of respondents have. 79% of you said yes. And 83% of the survey respondents said that gout flares negatively impact their daily lives. We asked how you are treating your gout. 74% of the respondents said they are treating gout with prescribed medication, and 52% said via diet and food modifications. And finally, nearly 60% of respondents said that they are aware that gout can cause kidney disease, and kidney disease can cause gout. These findings offer valuable insights into the experiences and knowledge of people dealing with gout. Understanding the connection between gout and kidney disease is essential for effectively managing the condition and avoiding additional issues. Now let's introduce our first speaker. Josie Cooper serves as Executive Director of the Alliance for Gout Awareness, a nonprofit patient advocacy coalition that works to raise public awareness around gout, reduce stigma, and empower patients to successfully manage their condition. Ms. Cooper is passionate about empowering stakeholders to advocate for improved access to care. Ms. Cooper has a background in communications, research, grassroots organization, and campaign politics. She has worked at the state and national level, advising political campaigns and public affairs clients on supporters and stakeholder mobilization. She has also worked on major races across the country, from presidential campaigns to Senate and congressional races. Prior to joining AGA, Ms. Cooper worked for a Washington, D.C. based consulting firm and for a trade association representing biotechnology companies. Ms. Cooper, thank you for joining us. It's my pleasure to turn the presentation over to you.
Thank you so much, Jerome, and thank you to AAKP for the opportunity to be here. As Jerome said, I'm Josie Cooper. I serve as Executive Director of the Alliance for Gout Awareness, and I'm pleased to be able to share a little bit about the Alliance for Gout Awareness here today and what we do as an organization. So, as you all may know, gout is a very common form of arthritis that is caused by an excess of uric acid in the blood. This is a condition that is extremely painful. It causes flares in a patient joint. But unfortunately, patients often don't feel like they have the resources to manage their disease. And so, the Alliance for Gout Awareness, our mission is really to make sure that folks can successfully manage their gout. We know that public awareness of gout is still lacking. And so, one of the things that we do is work to increase public understanding of this disease and reduce the stigma that patients often report that they feel. This is a condition that's been historically misunderstood. And so, our job is to change that at AGA, to make sure that healthcare providers, care partners, employers, policymakers, all of those folks better understand this disease. So we work to really increase that public understanding. And the second goal of our work is to empower patients. Gout is actually extremely treatable. And so we're here to help patients successfully navigate their condition, take control of their gout through proactive management of their disease. So you'll find here our member organizations. We partner with our membership to get gout resources and programs to the broadest possible group of patients and healthcare providers and policymakers. We know that gout and kidney disease are very closely linked, and so we particularly appreciate AAKP's partnership and the work on behalf of those living with kidney disease. So if you're coming to this webinar and you are a patient or a care partner, we have a lot of ways that we as AGA can help support you. If you check out our website, www.goutalliance.org, we have a number of free resources available that might be helpful. These include AGA resources as well as links to resources from our partner organizations. We have gout guides, videos, one-pagers, other types of resources that might be of interest. And we also host patient events, so in-person patient empowerment forums, webinars, other programs. We are really here to just be a resource to those living with gout. And so please feel free to check out our platforms. Okay, so as I said, more than 9 million Americans are living with gout. This is a chronic disease. It's very, very painful, but patients, unfortunately, despite treatment options, don't always feel like they're getting the best care. And so we, as the Alliance for Gout Awareness, in partnership with our member organizations, recently published what we call a roadmap to better care for gout. This is a guide for policymakers to really understand how they can better support those living with this disease and increase the amount of support that's out there. So there's a handful of pieces to the policy puzzle here that we highlighted, and I'll walk through each of those briefly. But we really believe that all of these kind of 5 steps are very, very critical to ensuring that people living with gout can manage it successfully and really live a happy, healthy, pain-free life. Okay, so the first kind of policy principle here is timely diagnosis. One thing that we know about gout, and maybe patients on the line have experienced this firsthand, is that diagnosis for gout sometimes takes a very long time. We have patients who developed gout when they were young, who went to multiple doctors and went a lot of years without a diagnosis because they didn't fit what a healthcare provider thought was kind of the gout profile. We have people who, had kidney disease, had risk factors for gout that, reported that, it got missed. And so that is something that we need to, at a policy level, change. Gout is often managed by primary care providers who might not have all of the newest information on gout or about the long term effects that gout can have. And so primary care sometimes focuses on diet and lifestyle changes, which are important if you have gout, but are typically not enough of themselves to manage this chronic disease successfully. And so we need to get more information to primary care, but also help support patients who, might need to see a specialist. So we believe that one of the key components to improving gout care is to improve that timely diagnosis. So both educating primary care providers in how to better manage this disease and make sure patients can get to a diagnosis in a timely manner. We also need to encourage people who, might think they have gout, don't feel like they've gotten the care that they need, to seek a second opinion, go to a specialist. If you are a kidney patient, your nephrologist might be well equipped to manage your gout, or they might refer you to a gout specialist like a rheumatologist. All of these, are ways that patients can get to the right care, whether it's through a specialist or by getting to a primary care physician who is educated on gout. The second kind of core area of improving policy related to gout is improved treatment guidance. So there are two broad approaches to treating gout. The first is by controlling the joint pain. So you're having a flare, you have significant pain in that joint, you want to treat that pain. That, I know Dr. Mandel will cover this later, comes through a variety of treatment options. What is as important as treating the gout flare is treating the gout itself. So gout is caused by an excess of uric acid in your blood, and so lowering the amount of uric acid in the blood is going to be critical to making sure that patients can actually have fewer flares, get their uric acid levels under control. To do that, to make sure that we're treating gout both in terms of the flare, but also in terms of the overarching kind of cause of gout, we need to make sure that doctors have good treatment guidance, that they have the tools that they need to support their patients. And so improving guidelines for medical professionals, making sure that everybody is working with the newest information is going to be really important for patients. So the third piece to the policy puzzle is expanded testing. So gout is actually pretty simple to both diagnose and monitor through a basic blood test. There's a couple of other ways you can look at gout and diagnose gout, but the simplest is a basic blood test. And so more frequent and earlier testing is a key component to improving care for gout patients. We can expand testing by raising awareness, by improving guidance around testing, and also by making sure that insurers cover this type of very basic test. So if you are a kidney patient and you suspect you might have gout, ask for a blood test. If you are managing gout already, but you're not sure on your levels, go get them checked. Ask for a blood test. That should be provided to gout patients in a timely manner on a fairly regular basis to make sure that we're monitoring, gout uric acid levels. The fourth piece is education and awareness. Because of misconceptions around gout, this is a disease that has been very frequently stigmatized. We did a survey a couple of years ago and saw that more than 25% of gout patients feared stigmatization by their friends or their family. That's actually the stigma, or the fear of stigma, is particularly severe in young patients as well. And so it's very important that we increase awareness, particularly around communities who are disproportionately impacted by gout. So we can partner on awareness campaigns. You as a patient can share your experience living with gout to help educate folks about this disease. And the last area that we focus on is increased access. Unfortunately, we frequently see insurance coverage as a barrier to accessing the best possible care in our healthcare system. And so we need to make sure that insurance coverage allows for patients to access the treatment that they need, whether that is, an older gout medication, a newer one, a test, whatever that is. And so we work to improve access to care, to break down coverage barriers, and make sure that patients can access and afford their medications. We are thrilled that gout is becoming much more manageable thanks to breakthroughs in research and new treatment options, but we need to make sure that patients can access those treatments in a timely manner. At AGA, just to kind of summarize, we strongly believe that there is more to be done for gout patients. And if we can address some of the policy issues that we see here, we believe that gout patients will be able to access the best possible care and successfully manage their disease. So, with that, we'd love for you to connect with us. We, again, have a ton of resources. We have patient programs, we have webinars, all ways in which we can help support you, whether you are a patient or a care partner or a family member. And so would encourage you to check that out. And we'll just close by saying thank you again to AAKP for the opportunity.
Thank you for that great introduction to the work of the Alliance for Gout Awareness. We appreciate the partnership between AAKP and the Alliance. Our next presenter is Dr. David Mandel. Dr. Mandel has been providing top-notch care to patients with rheumatic diseases in Northeast Ohio since 1982. After a successful career, he retired from clinical practice earlier this year. During his career, Dr. Mandel worked at University, Lake, and Hillcrest hospitals. He was actively involved in various professional activities, including participating in over 150 research trials focusing on emerging biologic therapies for arthritis and new treatments for osteoporosis. Dr. Mandel has also written numerous articles on these topics. As a respected leader in the field, Dr. Mandel is a past president and founder of the Ohio Association of Rheumatology. This organization works to educate government officials and insurance payers on the needs of arthritis patients. Dr. Mandel has also been dedicated to educating future healthcare professionals teaching rheumatology at various universities. Dr. Mandel, welcome. I turn the presentation over to you.
Well, thank you, Jerome. It's a pleasure to speak today. This is an important day to recognize how prevalent, how serious gout arthritis can be. During the presentation, what I'd like to convey is a couple of important points. One is that gout arthritis is a very serious type of arthritis if not well treated and well controlled. Two, gout arthritis is something that can be readily diagnosed with different laboratory tests and sometimes imaging tests. And three, the good part about gout is that it is a disease that can be controlled not only with diet, but for most people, the vast majority of people, require medication. So, with that brief introduction, we'll go to the first slide. I think many of you think of gout in terms of this picture, a red hot, swollen gray toe. And certainly this is very common for people who have gout arthritis. I often think of this picture as you could fry an egg on the patient's instep and big toe because you can almost feel the heat emanating from the swelling and redness. Some of this language may not image well, but I show it because gout arthritis has been with mankind for thousands of years. Dr. Thomas Sydenham was considered the Hippocrates of British medicine in the 17th century. And he describes his own attack of gout. And think about it this way. He clearly is in agony as he's describing himself with the torture and anguish of the pain and swelling of gout just by the, can you imagine the opening and closing of a door while he is sitting in a chair, lying on his bed? That kind of small movement of air causes severe pain and discomfort. There's nothing like that in all of medicine when we think about the pain of an arthritic attack. So this is a cartoon picture which shows just how people often thought about gout, where it was so uncomfortable it had to be caused by the devil himself. Often people, sometimes when they use the word gout, they don't always appreciate this is a type of arthritis, and this slide lists some of the many causes of arthritis, such as rheumatoid arthritis, degenerative arthritis, psoriatic arthritis. So, gout is a very common type of arthritis. What causes gout arthritis? Genetic studies have led to the discovery of what we call certain alleles. Think of these as certain proteins on our human chromosomes, and they regulate the excretion of uric acid from the kidneys. When uric acid builds up, it deposits in the heart, in the kidneys, and in the joints, and that's what leads to these painful attacks of gout arthritis. Approximately 80% or more of patients who have gout, we have identified these certain genetic factors that lead to the decreased excretion of uric acid. So, one, this is an important finding as a factor for leading to gout. So, what happens when uric acid builds up, and builds up? It deposits in the joints, and in this beaker of, we see at the top beaker, sugar dissolves in water and the water remains clear and colorless. But if you look at the bottom beaker, you can see this residue of sugar that has saturated in the water. The analogy is when uric acid builds up and builds up, it deposits in heart, lungs, kidney, and in the joints. On this slide picture, you're seeing a cartoon caricature of how people were often described as who gets the gout. It's an aristocratic, wealthy man, overweight. He's got his walking sticks by his side, and he's resting this painful, swollen foot. But now let's go to the next slide and see who gets gout arthritis today. It's younger people. It is not a disease of solely men. It's of many women. And we're actually living in an epidemic of gout where over 10 million people in this country have gout arthritis. And you recognize some of these illnesses: high blood pressure, high cholesterol, chronic kidney disease, diabetes. So, this is the prototype that I'd like you to think about as who is at higher risk for gout arthritis today. So, this is a somewhat busy slide, but will highlight a couple of important issues. As you see in the center, in the bullseye, high uric acid, hyperuricemia, and gout. When you have high uric acid, you put yourself at risk for heart disease. Normal blood uric acid, 6 milligrams. When it starts to percolate over 6 milligrams at 7 or 8, you run a higher risk for kidney disease. You diminish the filtration and blood flow through the kidneys when uric acid is high. We know people who run a high uric acid have a twofold risk of developing heart attacks. So there is a greater consequence to untreated hyperuricemia and poorly treated gout. So this slide picture shows uric acid deposition in many areas. You can see highlighted in the green coloration in the coronary arteries, uric acid's depositing there. There are these little white speckles in the kidney in what we call the medulla of the kidney, where uric acid deposits. Think about this. 25% of kidney stones are composed of uric acid. Let's move on to the spine. The green coloration is uric acid deposition in the spine. Now, most people, as they get into their 50s, 60s, 70s, begin to develop osteoarthritis or degenerative arthritis, where the disc will start to deteriorate, and many people get back pain. They may get sciatica. But some people with gout arthritis get bad back pain, not just due to degenerative or osteoarthritis, but because uric acid's depositing there. And this last graphic shows in the cornea of the eye, white coloration from too much uric acid. So in summary, uric acid can deposit throughout the entire body. Gout can sometimes show up in other joint areas. Here you see it in a swollen knee. This is a syringe containing joint fluid that we've aspirated from that painful knee. Normal joint fluid is usually clear, colorless. This has an amber coloration to it. It's composed of white blood cells and crystals of uric acid. And here are these needle-shaped uric acid crystals in that joint fluid. So this is the hallmark of diagnosing gout, when we actually remove joint fluid showing uric acid crystals, which we can image under a microscope. Here is an x-ray, and I think this images well. You can see a hole in the bone here. The bone structure is gone. And what happened? Eroded. It got so damaged from poorly treated gout arthritis, causing very severe pain. And think about this. We bear weight. We push off with our big toe when we walk or run. And this individual obviously has great impairment in walking. This is an ultrasound picture, and I think this will image where you see two lines here. On the ultrasound, we can actually see uric acid depositing. This happens to be the second toe of an individual who had a painful attack of gout. So we often use musculoskeletal ultrasound imaging to help us diagnose gout arthritis. And ultrasound often captures uric acid even before it will show it. This is another ultrasound. What you're seeing is high flow of blood through a painful, swollen joint. The dark area is fluid. The probe is put at the top here where the skin is. So we often find ultrasound a very important diagnostic tool. Well, uric acid doesn't always image when we touch people, when we see people. And we now have an even better imaging tool called a DECT scan, DECT. Here you see some person's hands, fingers. Some you can see there is swelling and uric acid even coming out of the joints themselves. And look at this green coloration. You see deposits of uric acid where it wasn't visible to the human touch and physical examination. And that's how diffuse uric acid deposition can sometimes be in patients. So I show you a patient of ours who had long history of recurrent gout. Look at this individual's knuckles. Can you imagine how did he work as a mechanic? Very difficult for him to handle some power tools, let alone use wrenches, screwdrivers. And here's his DECT scan, again imaging with green the deposits of uric acid throughout his fingers. This is an individual referred from a podiatrist in the building that we were in, and this white toothpaste is all uric acid. This individual had come to the podiatrist for several painful attacks. The uric acid, though, was normal. Normal uric acid sometimes presents at the time of an acute attack. Why? Because the uric acid is now all in the joint, leaving the blood compartment during the acute attack. This happens about 3 to 4 out of 10 times. But what happens when you see the patient, say 7 or 10 days later? The uric acid has now moved back into the blood compartment and may be a level of 7.5 or 8. But this person was a bit tricky in terms of diagnosis. But again, this is classic white toothpaste looking uric acid deposited in the joint. And here is that individual who had the swollen hands. And what we often describe here is these large lumps and bumps. These are called tophi. This is where the uric acid has settled in, and caused an accumulation. And you can imagine this individual had to increase his shoe size just to get around. And some people are so creative, and sometimes they are not always wanting to follow through with treatment. They'll cut a hole in their shoe to accommodate the large lump, the tophi, in their great toe. Tophi can show up in different places. One is on the sternoclavicular joint, as you might be able to see here. This is the near the collarbone. This is the buttocks, or what we sometimes refer to in a somewhat humorous way as the tophi tuchus sign, where the uric acid actually extruded out into the surface of the skin. Just like in other medical conditions, we often want to treat to a target. We have a target for blood pressure, for diabetes, and we have the same for gout. We always try to encourage people to eat a healthy lifestyle diet where they lower certain foods such as colas, Gatorade, Crystal Light. All these products have high fructose sugar. The liver converts all that sugar to uric acid. Beer, wine, and whiskey just loaded with purines that our livers convert to uric acid. Too much red meat, too many fatty foods and carbohydrates, all can, in the patient who is, again, genetically predisposed not to excrete uric acid, will find him or herself complicating the situation on a high purine diet. Again, what is our target in treating uric acid? As you can see here, we want to get the serum uric acid below 6. As we go lower and lower and lower, uric acid is eliminated from the kidneys. It then gets eliminated from the joints, and we find ourselves in a healthier position. When we go the opposite way, uric acid just continues to build up and accumulate. We'll see some general guidelines from the American College of Rheumatology. These have been modified a bit. We've talked about diet, lifestyle, but we know that medicines are the cornerstone for treating recurrent gout arthritis. Just like a diabetic patient needs medication to control his or her blood sugar, the same is true with gout arthritis. And allopurinol, fibutazat are 2 oral medicines. And we want to get that uric acid below 6. 5 is even better for many patients. So many times during that acute attack, we'll use other drugs that relieve the pain and swelling, such as colchicine, or an NSAID, an anti-inflammatory like naproxen. And these drugs are sometimes used for weeks or months for prevention and treatment. And then we start to bring on the allopurinol or the fibutazat, Uloric as it's sometimes called. But what happens to those patients, and there are many who don't respond to diet and medicine? We now have a wonderful intravenous drug called Krystexxa, which we'll talk about now. We administer as an outpatient Krystexxa every 2 weeks. This drug is an enzyme. It is not an immunosuppressive drug like some of the biologic drugs which rheumatologists like myself will prescribe often for rheumatoid arthritis or lupus, say. This is an enzyme. It converts the uric acid to allantoin, and this is excreted through the kidneys. And as I've often remarked to patients and colleagues, this drug works like Drano. It works very efficiently, very rapidly to clear uric acid. And here you can see just how rapid it works. I mean, a picture says more than what I can say, and how quickly from baseline on the left hand slide to right, it has abruptly cleaned out that uric acid from this individual's fingers. And here again, the picture showing the rapid clearing of green coloration to the background on the right-hand side, where that green coloration is pretty much resolved. This was a gentleman who had a tophus by his outside ear, and after 3 infusions, it's gone. Literally, here today, gone tomorrow. So why is gout so poorly treated? It's what I often call this dysfunctional dance between the patient and the physician. The patient comes in to see his or her physician, physician assistant, nurse practitioner, and says, listen, I was in the emergency room a couple of times in the last 6 months since I saw you. And he says, or she says to him, I was diagnosed with gout. And they treated it episodically. They just gave him some naproxen or ibuprofen. And the physician says, well, it's just episodic. It's going to come, it's going to go. And then the physician says, but it's come on quite a few times in the last year. Why don't you start on this allopurinol? And the patient says, doc, I'm taking blood pressure medicine, diabetes medicine. I just take too many pills. It costs too much money. The physician starts to look at his or her watch. 5, 10 minutes have gone by. They then end the visit. Then the doctor says, well, why don't you just cut out the beer? And the patient says, you're right. I'll try to change my diet. And we know that that's not going to resolve the problem. And he or she will be back again. But this is a huge problem that exists today. So this was a colleague of mine who saw a patient with gout arthritis. You can see how this individual, and he happened to be a plastic surgeon. How could he do surgery with these hands? God only knows. And you can see he's resting his hands on the pictorially, and you can see just the difficulty he had, but he started to get cristexa, and that's what you're seeing on the next slide here. And 2 years later, look at these hands. I mean, it's just remarkable. We don't have any other medicine that works so well. And as a physician, this has been very gratifying to help people get their lives back in order. These are some resources that have good information for you about learning how to manage gout. In summary, we're living in epidemic times. Gout is due to an excessive high burden of uric acid. Lifestyle changes make a difference. Oral medicines work well when they're taken, but sometimes people can't always tolerate it or they don't always benefit. And that's when we need to bring on pegloticase, or what is sometimes referred to as cristexa. Okay, I think that wraps things up here. And we'll go to take some questions.
Yes, thank you, Dr. Mandel. That was a wonderful presentation. We do appreciate you being here. As you mentioned, we have a few questions that people who registered for today's event submitted that I'd like to ask you. The first question is, what is the difference between gout and other types of arthritis?
Thank you for that question. Uric acid deposition is the cause of gout arthritis. That's different than rheumatoid arthritis, which we're just starting to understand the cause of, which is complicated, more of an imbalance in immune function. Degenerative arthritis is a breakdown of cartilage that leads to pain and discomfort. So the pathogenesis, the cause of gout, is really quite different, even though some of the symptoms of arthritis can be pain, stiffness, swelling.
Is there a difference in the cause of a gout attack if the attack occurs in the knees versus the toe or foot?
They're identical in that there is an overabundance, an accumulation of uric acid, whether it's in the knee, whether it's in the shoulder, or whether it's in the great toe. It's due to too much uric acid in that specific joint.
And the last question, can you talk a little more about the lifestyle changes a patient can make to help manage gout?
Yeah, I think it's really important to look at lifestyle in a greater totality. We talked about the impact that certain foods have on uric acid accumulation. Things like too much high fructose sugary drinks, too many carbohydrates, too much red meat. But we also know that exercise, sleep patterns have an effect on our body's immune system. And it's really important. I know sometimes these issues get short shrift, but I really want to emphasize as we are studying the impact of healthier sleep habits, healthier exercises, these also have an important effect on gouty arthritis and other types of arthritis as well.
Dr. Mandel, thank you for joining us and providing the latest information about gout and its treatment. Your presentation was highly informative and greatly appreciated as always.
Well, it was a pleasure for me to participate in this, and I wish all of those who watch this have a joyful spring and summer, and just good health to all of you.
Thank you. And our final speaker is Kent Bressler. He currently serves on the AAKP Board of Directors, is an AAKP ambassador, and is involved in AAKP's Veterans Health Initiative. In 1982, Mr. Bressler was diagnosed with FSGS. In 1987, he received a kidney transplant from his brother Kip. Mr. Bressler is very involved in the kidney community. He volunteers as a consumer peer reviewer for the Patient Centered Outreach Research Institute and the Department of Defense Congressional Directed Medical Research Program. Additionally, he is an active member of NephCure International, an agency dedicated to finding a cure for FSGS, co-founder of Kidney Solutions, a nonprofit organization that helps patients find kidney donors without any fees or charges, and host of the podcast Kent's Kidney Stories. Mr. Bressler is here to share his experience about living with gout. Thank you for joining us, Kent.
Thank you, Jerome. It's an honor to be here. Gout's been in my life for almost 50 years now, and it's a tough route. But right now, I think I've pretty well grown out of it. It's pretty well under control.
Can you tell us a little bit about your kidney disease journey?
Yeah, it started out with a biopsy that showed that I did have FSGS. That was back in 1980, 84 in that neighborhood. But my gout incidents actually started before that. I had gout as my kidneys continued to fail. It became more and more apparent that the gout was part of this whole journey, and it was very painful and all-consuming. Fortunately, I had a very good nephrologist who was on it right away and treated it. Back then, there was not as much medication out there for treatment, but the one that I've been on for the last 30 plus years has been very beneficial to me.
How did you know you had gout? What were some of the signs and symptoms for you?
I can remember distinctly the first bout of gout that I had. And I woke up in the middle of the night and my left big toe was on fire. And someone had maybe poked a red hot poker right into the joint. I was sick to my stomach. It hurt. It was so painful I couldn't even put the covers back on my foot. Couldn't walk. And I called the doctor and told him what was going on. He says, "Well, you've got the gout." And that's when we started the treatment.
Now, how do you explain gout to other patients?
Well, I think it's pretty easy. Once you've actually experienced gout, you've had the pain and the discomfort that comes with gout, you'll never forget it. And you'll know, you can almost anticipate when it's going to start because it doesn't start with a loud hurrah. It starts slowly. And within a day or so, after you've learned about it, it's very, very consuming. It's all powerful and it's very, very painful, very debilitating. And it's very dangerous for your kidneys over the long haul. If it's not treated appropriately, it can damage your kidneys, especially if you've had a transplant. So I've been very wildly aware that I need to keep track of it. And so I get blood work drawn periodically right now every 4 to 6 months. But when I had the gout, it was every 3 months, sometimes even sooner than that. And I had the episodes over my life. I'm 74 now. The episodes have decreased significantly. I haven't had an episode of gout for roughly, I think, probably 5 years now. But I've been on a treatment, and it's helped tremendously. Not on any of the new drugs. They're all old and well-timed drugs that have been around for a good while.
What are some of the ways you manage your gout
Well,
besides medication?
yeah, early on, I learned that there were some foods that were not good for me. All right, that triggered the gout, and I also noticed that one of the things that if I did activities that were outside the norm and did them in excess, that was usually a trigger for a gout incident. Now, mind you, that's not always in the toe. I've had it in the elbow. I've had it in the ankles. I've had it in both wrists. I've had it in the shoulders. And so you really need to get it monitored. You need to know whether or not you've got uric acid crystals. Then there's a test for that, blood test. And if that's elevated, then nowadays they can actually do a little a biopsy to see if those crystals are really inside the joint and to make sure they're uric acid crystals.
What are some resources you would recommend to other kidney patients who are dealing with gout?
You know, I've always gone to my physician. I believe very heavily in my physician's pedigree. He's always been able to monitor it closely, but there are lots of resources out there. AAKP has a tremendous amount of resources concerning gout, and we spend a lot of time with people who have had gout. And so I encourage people to go to any of the websites that and learn about gout. The major hospitals like Mayo and all the different hospitals have sites that will tell you how gout is. And of course, there's a multitude of information out there from the drug companies that is very, very factual and has been vetted. So I would encourage internet searches, but also I would always go through your physician. You stay in close contact with your nephrologist. He's a specialist in this, and he may refer you to a rheumatologist. I do go to a rheumatologist when I have a flare. So the treatment for flare is different than for the chronic condition. You need treatment for both, and be ready for both.
Ken, thank you for sharing your kidney journey and your experience managing gout. Your openness and willingness to share your story with us it's truly appreciated.
Thank you very much. I appreciate y'all.
If anyone watching has additional questions for our speakers or about today's webinar that we were unable to get to, please email us at info@aakp.org, noting the webinar title in the email subject line. In closing, if you are not already a member of AAKP, we encourage you to join. AAKP offers free membership to patients and their family members, as well as living kidney donors. To become a free member, join online at aakp.org/join or by phone at 1-800-749-2257. To receive all the benefits of membership, please be sure to include your email address when signing up. As an AAKP member, you will be notified about all of AAKP's upcoming events, the latest in our educational program series, and when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the independent patient voice and change status quo kidney care. You will also receive a digital subscription to our bi-monthly magazine, AAKP Renal Life, and can select to receive any of our 5 different electronic newsletters, all for just signing up. We also invite you to check out our blog to read some great articles and patient profile stories and follow us on social media for all the latest news and to keep up on what's trending. AAKP is dedicated to helping kidney patients across the disease spectrum understand their condition and take control of their healthcare. We are proud to offer a variety of resources for both patients and care partners. By visiting our website at aakp.org and clicking on the AAKP Store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download free of charge, including titles such as the AAKP Understanding Gout and Your Kidneys brochure or the Conversation Starter Questions to Ask Your Healthcare Team About Choosing the Right Therapy for You. You can also order materials by phone. AAKP has a number of exciting events planned for 2024, including our 6th annual Global Summit on Kidney Disease Innovations, hosted in partnership with the George Washington University School of Medicine and Health Sciences, which will take place virtually July 16th and 17th. Our 7th annual Policy Summit is scheduled to take place November 20th at the National Press Club in Washington, D.C., and will also allow for virtual participation. Registration for both events is now open. AAKP 49th Annual National Patient Meeting will be a hybrid using AAKP's sophisticated virtual event platform with the in-person component taking place in September in the beautiful state of Florida. The dates are to be announced. And finally, you can also visit our YouTube channel to watch a number of great presentations and webinars, all available on demand from our 2023 events and programs, as well as 2024 programs as they occur. We would like to extend a heartfelt thank you to our webinar speakers, Josie Cooper, Dr. David Mandel, and Kent Bressler for graciously participating in today's HealthLine event. Their expertise and insights greatly enriched the discussion and provided valuable information. We also want to express our gratitude to all who joined, as your presence and engagement helped to create a dynamic and engaging atmosphere. Thank you all.